So, welcome to another episode of the Dynamic Chiropractic Podcast. I am here today with Dr. Chris Zaino, all the way from the States. So, Chris, I just want to say thank you again for taking your time today to come on the podcast. I really, really do appreciate it.
I appreciate you, Jack. Thanks for having me,
Nice.
guys. And
Thank you.
everybody watching will get some good value. I promise you. And yeah, I'm excited. Let's do
Yeah,
it.
yeah, I've no doubt. So everyone who listens, make sure you grab a pen and paper, sit back and relax, and get ready to learn something new. So, cool. So, can I call you Chris?
Yeah, call me
Is
whoever,
that
whatever you
okay?
want. Yeah, yeah,
Perfect. That's fine.
yeah.
So, Chris, how did
Yep.
you get into chiropractic?
All right, great. Good story. So if you ask me, well, did you ever want to be a chiropractor? That wouldn't even been 10,000th on my list. So I got into chiropractic through an experience. I found in my life, when you have an experience, a lot of times we have an idea of what we want to do or anything in life, and sometimes experiences just they course correct your life. So at the time I was in my early 20s. I was personal training. I had my degree in exercise physiology. I won Mr. America at the time, so I had a cover. So I did fitness modeling, cover magazines. Xeno Warrior Princess, and they filmed that at Universal Studios Florida and in New Zealand. So I was the trainer and nutritionist for that whole for the actors, right? Because they had to look a certain way. So I had a really good gig going, and I was like, yeah, I could do this my whole life.
Nice.
And then, maybe a year or two after, I just started developing stomach issues, but no big deal. Like, because I ate right, I exercised, I didn't drink any alcohol at the time. Like, not that I even drink it now, but what I'm just saying is like,
Yeah.
what I'm trying to say for chiropractors or people watching is, I'm setting you guys up for will I look good or feel good, right? Because most people think health is how they look or they feel. So I didn't drink or just think I drank water, still drink water today, right? I didn't smoke, didn't eat shit, didn't have fast food. Then I just have stomach problems, go in the bathroom a lot, no big deal. And I'm young, like we don't I never had issues, right? So we're doing it. And then now I'm going to the bathroom 13, 16 times a day. Now I'm bleeding every time I go to the bathroom. Now I'm like let's say I had this call with Jack, I would not eat for 5 hours before, so things would go through me. So now it's really nothing's getting better. Then I'm bleeding every time I go to the bathroom. So then I go online on Google and I type in, blood and stool. And sure enough, what pops up is cancer, right? So I'm like, my dad had died of cancer when I was 21. And I disassociate. I think a lot of people do that. Like they see something and they don't want to deal with it. And they do this. So they think turning away from it, or like the check engine light on my car. And I did like, you can't
Yeah.
do that. You can't do that. Because but yeah, I mean, but sometimes it's a reaction we have as human beings. So I wound up going from about 230 pounds. So I'm about like 220 now. So just think like this all the way down to 158 pounds in about 3 months
Wow.
and bleeding. And then it got to the point where like you would think I would do something about it. But this is how sometimes it's not that we're stubborn. I think people get scared to face something. So it got to the point where I was in a TJ Maxx. A TJ Maxx is like a clothing store here, right? So I'm in there,
Yeah.
and every time I would go to a place, I would always make sure where the bathroom was because the bathroom to me represented like home base. Like because I'm always in the bathroom. So I just need to know if I went anywhere, I needed to know where the bathroom was because there's a huge chance I was gonna have to use the bathroom. So I went there, and the bathrooms are under construction. And I was like,
Ah.
where's the bathrooms? They're like, well, go outside and there's a Sports Authority, which is like a sporting goods store next door. You could use them there. And just the nerves of not knowing, because it was more than a physical condition. So I really realized that when you have a physical condition, a physical problem, that you cannot take the spiritual side out of it or the emotional side out of it. Like it affects everything. So it just the fear and the anxiety of knowing that I didn't have this bathroom viscerally made me had to go to the bathroom, right? So I didn't make it out of there. I lost my bowels in public, and that's
Oh
not just a
man.
it's bad. So it's like it's not like sometimes you guys could lose your bowels in public, but like when it's blood and mucus and it's just and then so you have all these people see it and they feel bad, but they're horrified because no one's seen this before. So it was one of those rock bottom moments. Went to the doctor and they said I had an incurable terminal disease, autoimmune disease called ulcerative colitis.
Hmm.
So, like many of you may know, it's just autoimmune means your immune system's attacking. So my immune system was attacking my colon. RA attacks the synovial fluid of the joint. Psoriasis, your immune system attacks the skin, right? So So they put me on prednisone, which is the toughest drug you could take to lower the. So they put me on immunosuppressants. So I mean, just the term of it, what's an immunosuppressant? It's something that's going to shut down your immune system so it doesn't attack itself. But at the same time, you're robbing Peter to pay Paul. So like you're shutting down my immune system. I might not exhibit as many symptoms, which it didn't work. It was actually making things worse. But now I'm
Yeah.
immunocompromised, right? And it just got worse and worse, drug after drug. Then they did organ rejection medications, chemotherapy drugs, nothing working. So finally, I'm looking at taking out my colon. So they're going to take out my colon because it was
Wow.
actually ulcerative colitis is lower intestine, Crohn's disease is upper intestine. Well, there's a condition where the ulcerative colitis starts to splash into the small intestine, so you start to get Crohn's colitis, which is you're done. So they were going to take out my lower intestine, and I was about a week away. And my anatomy teacher from high school, my mom sends out a prayer email, so that's how this guy knew. So she sends out the email, pray for my son, pray for my son. So my anatomy teacher from high school, he says, "Listen, I want to see Chris when he's in town, because I went to see my mom." And I saw him. He's like, "Listen, I need you to go see my doctor. He's a corrective chiropractor. It'll fix everything up." Very nonchalantly. Now remember, I went to the best in America
Yeah.
or top in digestive disease. So how is chiropractic, which was to me like a muscle modality, like not a massage, but a muscle modality? Because I mean, that was my experience in high school. They taped up my ankle, they stretched out my hamstrings. So you got to understand, guys, like people's first impression of something could like set the tone of what it is. So my ignorance of what chiropractic was, or the lack of education that the chiropractor did not give me when I was playing sports, gave me a perception of what it was. So I was like, how is this going to help an organ disease, if anything? So it's like, he's like, listen, I go, thank you, but I tried everything. So remember that. So a lot of times, if you or your patients will say, I tried everything, what they don't realize is they're in a state of hopelessness. Because when you say I tried it all, you said there's no other options, like I'm done. So I listened, thank you, but I tried everything. But then he told me, goes, well, you didn't try everything because if you tried everything, you would have had your health. I was like, holy
That's so
shit.
true. Wow.
He's right. Like, so like that was just enough to crack the door open. Like I wasn't fully it, but it's like I at least got that thing, like, you know what? He's right. If I tried everything, I would have had my health. Like I would have had something.
Yeah.
So, and like, and yourself, your patients, they don't realize they get to a hopeless state like that because you just don't see it coming. I'm like, oh my God, he's right. So I went to see the doctor. He took x-rays of he talked to me about chiropractic, took x-rays of my spine. No one did that. Then he sent me through a talk explaining what the nervous system was. But it was all laws. It was like irrefutable laws. Very easy. Very, I call it Dr. Seuss, like very like brain controls the body. Yes, if I cut off the head, body died. Like I couldn't call bullshit on it, right?
No, of course.
I mean, it's a law. It's like saying like if I drop this pen, like it's gonna drop 100. Yeah. So it's like he just talked in laws, not over talking me, not using fancy doctor terms. Just I'm like, yeah, nervous system controls everything. So then I went back, looked at my spine. He taught me what subluxation was, right? Okay,
Right.
my lower spine. I had a huge curvature in my lower spine, and I had about 50% pressure on my brainstem. So it's like these are the centers that go to the immune system. This is like the it controls all the subconscious protocols of the body. Lower nerve roots go to your intestine. Yeah, all made sense. So, but still, I see it. But I'm like, okay, well, you know, uh, when am I going to get better?
Yeah.
And that was the thing, because that's all people want to know. When is this going to stop? Or what can you guarantee? It's either two things people can know. What are you going to guarantee? Basically, I was saying, when am I going to get better? Is basically, like, what are you going to guarantee me? And then this chiropractor was so mature, and I think that, and what I want to like chiros that are watching, it's very important you have ultimate confidence and certainty of what you do, because you could then stand and say a mature statement like this. Because when someone says, "What do you guarantee me?" or "When I'm going to get better," we tend to answer that question.
Yeah.
Well, it could
So
be
true.
2 weeks, 3 weeks. Like we're throwing out some bullshit number anyway. How do we know? Right? But what's the truth? What's the truth? We don't
We
know,
don't know. Don't know.
but the body knows, right? So he goes, "What am I gonna like? What am I gonna get? Like, when are you gonna get better?" He's like, and he goes back to my problem. He goes, "As long as you have that problem right there, all right, your body is not in the environment to be able to heal itself. And he goes, puts it all back on me. But when you choose to correct your problem that you have that's causing your problems, when you choose to correct that, then your body now will be in the environment. That means the possibility to heal. And he goes, and I don't know the day or the hour it's going to happen, but your body will heal as long as you don't quit on yourself. So you see that comes from a mature, seasoned, experienced doctor that is not trying to give the answers. He's okay with saying, I don't know. He's okay with saying, listen, I don't know, but your body knows. You just need no interference. And that answer to me was so good because the best digestive doctors and disease doctors in the world, they always had an answer for me. Once we do this drug, okay, no, we're going to switch to this drug. No, okay, now we're going to take out your colon. So they always had an answer. And sometimes it's like the answer was not the answer. So I appreciated I don't know, I appreciated like, you're going to get better as long as you don't quit. Like it was an honest answer. It was not, they were not like saying, like sometimes I think as chiros, we want to give the patient something they want to hear to appease them. Like after the adjustment, you might want to put a little bit of ice on that. Like, how do we know the body wants ice? Or how do we know the body wants vitamin C? We're just trying to give them answers because we want to validate our treatment. We want to, versus telling the patient, like,
Wow.
your body's
Yeah.
good. There's no interference. Like, well, I'm inflamed. Great. That's the body doing what it needs to do. So he was
Yeah.
just a very mature, principled, centered, confident doctor. So that was the most honest answer I ever heard. So I was like, okay,
Wow.
that makes sense. I get it. So I wish I could tell you guys in a week I was better too. No, like about 5 months later, my weight was stabilizing. The blood was coming. So I mean, it took me about 5 months to see improvement in myself. And therefore, when you see something working, now you have momentum. But
Yeah.
that time when you don't see results, that's where the faith comes in. Like sometimes, like I noticed as a practitioner, I would tell patients sometimes when they're nervous and like, listen, I am nervous. I'm scared. I'm like, I know. I go, and sometimes I tell people, I'm like, you could borrow some of my faith and confidence that you're going to get better. Like, why don't you borrow some of my belief that you're going to get well until you start seeing results? Because I know you'll get better, but I know they're scared. So about 5 months, I saw enough to be like, okay, I'm healing. I'm going in the right direction. And 7 months later, the blood had stopped and my body healed itself from an incurable disease called ulcerative colitis. But
Wow.
it wasn't an overnight thing. But here, I think that's a good point. What if I said, I'm going to give this thing 90 days? Well, and I think we do the same thing, whether it be for health or like we give something, we make up an arbitrary number, or sometimes our patients make up an arbitrary. Well, that because what happens is we feel in our mind, we make something up saying, you know what? I think for the amount of time I put in, the amount of money I paid, and the amount of effort I put in, I would have made better results by now. Right.
Yeah.
So, like, let's say someone's exercising dieting. They're like, it's been a month with the amount of cardio I put in, the training I put in, the time I put in, and the dieting I put in, and they lose a pound. Even though they lost a pound, they think, I thought I should have lost more. Well, it's just they're pulling it from, I thought I should have. Like, there's no data. There's no, so sometimes patients, or even when we do it ourselves, we just don't give ourselves enough time organically for
Yeah.
something to do its job. So imagine if I said, I'm going to give this 90 days. At 90 days, still bleeding, nothing really changed. Even though I know internally things are clearly healing, but I didn't see any results of it. Let's say I say, well, I'll give it 4 months. Not a difference. 5 months, I started seeing some results. 7 months, no more blood. So, but imagine if I said, I'll give this 90 days because I felt by 90 days I should see something. So a lot of times we put arbitrary timelines on stuff. I'm going to give this relationship 30, like just think about the times we put, I'm going to give marketing. I'm going to, whatever that is, we just put an arbitrary number versus saying, listen, I'm going to do like Jim Rohn used to see something great. He's an American speaker. They're like, well, how long are you going to exercise for? How long are you going to do chiropractic for? Like, how long are you going to give something a chance? And his answer would be until, until the result, until I
Yeah.
like, how many books are you going to read, guys? As many as I need to. How many chiropractic seminars are you going to go to? As many as I need to. How long are you going to, like, as much as it takes to get, like until the result, until I'm at the vision I want to be at. So when I have a story like that, now I have an experience. So I'm like, listen, so now I went back to school and I went to Life University first. And at that time, they had
Nice.
lost their accreditation in Marietta. So
Oh,
if you
wow.
guys don't know that story, back in the day, Sid Williams, which was amazing, he was like a chiro fighter, and the boards wanted the school to shift in a certain way. So at the time, I didn't realize it. He was like the bad guy, Sid Williams. But looking back, you're like, oh, like he was just defending the purity of
Yeah,
chiropractic. So the
absolutely.
boards wanted to take it a certain way, and he's like, no, I'm not. So the
Yeah.
board's like, okay, well,
Yeah.
your school lost its accreditation, so the school and everything shut down. So I lost all that student loan money. So then I went to Dallas, Texas, to Parker, and finished school there. And in 2005, I opened up my clinic, and you know, within I would say within about 5 or 10 years, we were seeing upwards around 2,800 people a week for many, many years. I mean, it was
Wow.
just amazing. And it's funny. I'm glad we're having this podcast because right now, at 46, um, I had a recent turn of events and stuff like that, and I kind of slowly started pulling out of the practice or losing my focus on it, not doing the things that I used to do to make it successful because I just didn't want to anymore.
Sure.
And then it's like, so now I'm like, even now I'm kind of like going back into the practice and doing what takes to rise it up again because I'm guilty as anybody with chasing blinky shiny objects,
Yeah.
because sometimes you hit the top of something and you're like, okay, what's next, let's do this, let's do that. And I realized that there was a lot of things that I trusted that I didn't have control over, but nothing. You don't have like when you're actually in it and you have, or for instance, I found things that made money outside of chiropractic. But I realized like you can make a lot of money and you could see the numbers go up, but I wasn't waking up with a purpose anymore. And so
Right.
what
I
that means
see.
is like, Jack, if you ask me if you ask me today, am I happiest? No. And
Right.
I'm very transparent. Guys, like that's why podcasting are good because I'm always transparent with you guys. Like,
Yeah, I love that.
why am I not happy right now? I was my happiest when I was waking up every morning. No, I was woken every morning with the purpose of trying to be the best in the world at something. And chiropractic it served all my human needs. Tony Robbins talks about the human needs. Like I don't know them all, but um, yeah, let me see. Let me just bring them up real quick. Hold
Yeah,
on,
go
hold on.
for it.
It'll be worth it. So it's like um, six human needs, right? Tony Robbins. Okay, and I'll explain why.
Yeah, no, go for it.
Here. Okay, look. Got it. So there's six human needs that gets you out of bed, that makes you feel like you have a fulfilled life. So what I noticed, and I want to tell you guys now, like, do you deserve to have millions in the bank? Absolutely. Okay. But I coach and I consult a lot of CEOs and sheiks. I mean, some of these sheiks, they're trillionaires. I mean, Forbes, they laugh at
Wow.
Forbes list. But there's other parts of their life, like their health or their relationships that are absolutely shit. And
Hmm.
it's amazing. Like I've seen people and I've coached guys and gals like, how are you so excellent in a business? How can you make hundreds of, but you're so shitty when it comes to your health. You're so shitty in your relationship. And
Yeah,
it's not about being unbalanced. It's because of like deep down, they don't have a fulfilling life.
right, got
So
you.
let's go over the six needs here. One is certainty. So chiropractic is I go in and I have something I could be certain on. I know the principle works.
Yeah,
You know, I think the principle works 100% of the time, but because of limitations of time and matter, I just think that people don't give it enough time and or
yeah,
the body is just to a point where there's limitations to time and matter. So certainty knows that we could go. The certainty is like we know we could go in, we could adjust. We have a job that's serving with certainty. Like, another human need is uncertainty. Wow. So we need to go like if we know everything, it gets boring. So uncertainty, that's you have patients coming in with different things and different personalities. So every day it's like the box of chocolates, right? You just don't
yeah,
know what
for
you're gonna
sure.
get. So it
Yeah,
creates uncertainty or marketing changes or this happens or like so there's a lot of uncertainty in there, right? Is that person gonna sign up or not? So it has an element of uncertainty.
hmm.
Um, Significance. I mean, when someone says, hey, listen, like I dealt with this problem or I had these issues or my husband and I were infertile or our kids suffer with ear infections and now they're healing or like You made us, you not that you made their pain get better.
No,
You helped them adopt a philosophy and a principle where they didn't have to be enslaved to a medical model or enslaved to thinking the body was created weak. See, like,
absolutely.
like
Yeah,
when a parent allows their child to heal from an ear infection without drugs and tubes, it means that they have faith in how the body was created to heal and function. And so just that's significant. So you like you're going to work, there's a significance. Now I'm not like, like going back, like day trading and making numbers go up and down. Like you're only significant to yourself, but like to know that, like,
absolutely.
listen, I'm playing a significant part in improving the quality and history of people's lives. So there's significance there. Connection and love, right? Connection and love. Like when you're a principal, like you have a love for your patients, you care for your patients. And for a lot of you, you're going to see a lot of people. I don't care what your volume is a week. If you see 50 a week, 30 a week, or 2,000 a week, that's a lot of people. So there's a connection and love. You're touching people. All right. Like there's a connection there. And what I love here, connection, watch this, growth. Okay. Like, and I think that's where I started getting a little depressed was my practice hit a state 2,800 a week, and if I and to me I put my I put my scoreboard on the number of adjustments, right? So if I wasn't sustaining that or it was going down, I feel I wasn't growing.
Right, I
So
see.
we're spiritual beings on a physical journey. So it's a universal law. The universe is what? It's for growth, evolution, expansion, and forward progress. Do we agree? Like, so
Absolutely. Yeah,
if you're not growing, if you're not evolving, if you're not having forward progress, and if you're not right, then
absolutely. Yeah.
it's against the universal, like you're going against the universal law. So of course, if you guys are sitting there and you feel depressed, you feel down, and you don't know why, you feel like you're grieving your potential. There's just this something I meant for more, because that is what you're created to do. Like you're created to grow and expand and evolve and move forward. So like chiropractic, like there's growth, there's evolution, there's forward progress, right?
Mm.
And then the last one is contribution. You know, that's another human need. I'm contributing to people's lives. Like there's things that, like, a lot of those things you can't buy, right?
No,
So chiropractic is one of those professions that fills those human needs. And the reason why I'm pointing out to you is because sometimes we we're not aware of it, right? So sometimes when you have no awareness and it's in front of you, you may take it for granted. And so I realized even now, like I know I digressed a little bit, but at 46 years old, I'm like,
no, no.
do I want to learn another skill? No, because if I want to learn another skill, like I go back and become like a plastic surgeon and do nose and boobs.
Yeah, of
But
course.
but it's like I don't want another skill. Like this is a skill I have. I just need to go back to the basics. I need to go back to what got me up in the morning. Happy to, you know, be the best person I could be, so I could bring the best of me to help people, to be significant, to give contribution, to give love, to have the certainty, to have the uncertainty, to have all those things. So I realized, like, as a chiropractor, it's so easy to be like, well, crap, so and so has a company making 200 million a year, but it's like I coach a lot of those guys and gals, and they don't have they don't have the human needs, they don't have the significance that you would have. So I went back to school, started my practice, and because I had a story. And a lot of people are like, well, I don't have a story like yours. And the thing is, you don't need to have a story like mine. Like a lot of times,
No,
because what I did is I just tell my story, just like I do there. And I mean, I did it with dinners. I did it with just everywhere I could speak. I would speak and tell my story. I mean,
that's great.
I had one move. You know how people like I had one move that I practiced tens of thousands of times. That's that Bruce Lee said. I'm not afraid of the guy who has 10,000 moves. I'm cautious of the guy who practiced one move 10,000 times. Right. So
Absolutely. Yeah.
yeah, well, isn't telling your story boring? Yeah, it gets monotonous, but it's like, here's my one move. I told my story. It was enough for people to say, let me check out this chiropractic thing. And I educated on the principle. And you don't have to have a story. I mean, I coached a chiropractor he came from a family of chiropractors. And the guy, he was not vaccinated. He says, I was never sick. I never had a problem. My parents I'm like, there's your story.
There you
Like
go.
you're the
Yeah.
living, breathing principle of it. Or you don't have to have like I don't care. You could just tell testimonies you've heard or something like, but I just think the principle of what health is is enough for people, especially today, to because no one really likes drugs or medication. No one knows what
No,
health
not at
is.
all.
So it's taking a patient into awareness. Like I said before, we start like people think health is how they look or feel, right?
Yeah,
And I would tell them, okay, I would corner them. Health is what how we look. Okay, so if we look at health on how we look or how we feel, then let's look at the top two disease killers. Cancer and heart disease. Raise your hand if you know someone had cancer and heart disease in your family. The whole room raises their hand. I'm like, here's the issue. If you wait for heart disease, which first symptom, heart attack. If you
it's a
wait for
heart attack.
cancer, can you have stage 4 cancer and not feel it? Absolutely. So if we based our health on how we look, how we feel, that's why 5 to 6 people get heart disease and cancer. So they're like, shit, that's right, because you don't feel it. In fact, they're in your body for decades. You don't feel it. Then the third thing is the third cause of death. Well, I don't know if it's the first. I don't know. I don't know where medicine is right now. It's first, second, third. Who
No,
cares? But it's like, but then the third or the number one cause of death, I used to say, is what we do when we don't look or feel good is what? We go to a doctor and they say, what? Give you a drug or a surgery.
that's it. Yeah,
Right. So you start giving them awareness, like, holy smoke, what I've been doing for my health is a backwards model. It's an outside in, it's a it's not a causation model. And because of waiting to if basing my health on how I look or I feel, that's why you miss cancer, you miss heart disease, and that's why if I feel bad, I take a drug to mask it. Like that model of health is not working because it's not even what health is. And then I tell them health is the optimal function of your body, mentally, physically, socially, and spiritually,
yeah,
and not merely the absence of sickness or disease. So health equals 100% function. I have them all write it down. Health equals 100% function. All right, so if health equals 100% function, then what controls function of the body? Like, you know what I mean? Like, I don't have to say chiropractic. I don't have to say subluxation. Like,
no,
we just tell them the facts and everybody answers, well, our brain, right? So what's your brain control? Everything. What controls your heart? What controls you're my brain, right? Like, and you guys go into it. So, I didn't build a large practice I built a large practice by, like for example, so and this is not a religious statement. I'm just giving you
no, no, sure.
I think so when Jesus talked to people, um, he's an amazing communicator because back then all you had was to speak, right? We're not even
Mm.
like this has nothing to do with Christianity. It's just like how did someone build a movement in 3 years, right? Well, it was speaking, right? And then notice, but wherever he went, he spoke the language of the people he talked to. So a lot of the parables were in the language. So if it was a bunch of farmers, he spoke, well, it's like spreading seed, right? Like he spoke in their language of what they knew. You follow?
Yeah,
So he
absolutely.
didn't bring
Makes sense.
some metaphysical spiritual term that blew him out of the water. So I'm not speaking like neurophysiological terms and neuropathy, like not, I mean, like not, neuroscience is like if I'm speaking to a certain group of people, I'm going to speak in their language. I'm going to use examples in there what they're familiar with. So notice that like when Christ talked, he spoke in parables that were familiar for the people he was talking to. So I think a lot of times we like to use big doctor terms and stuff, and it's not impressing anybody. It's just confusing people. And all you want people to do is connect the dots in their head. Like, wow, health is 100% function. Great. What controls function? My brain. If I cut your head off, what happens? I'm dead. Well, how about this? Let's say, like, what controls you, what houses and protects your nervous system? My spine, right? So if my spine is damaged or twisted, or there's slight pressure on the nerve, is that area going to get healthier or sicker? It's going to get sicker, right? So,
Absolutely.
now if I put drugs on, is it still there? Yes. If I cut it out, is it still there? The problem's still there. But if we correct that problem and take pressure off the nerve, is the problem get better or worse? And I guess it's get better. So, you know what? I guess I use a very simple way of explaining chiropractic, and I found again the more simpler way, having people come to the conclusion what it is, then people said, okay, this I want to choose you as the doctor to take care of my health and my family. So I wish I could tell you I had some great fancy thing, but it was just telling my story, my experience, telling laws facts like gravity, right? Simplifying it. And that was enough for people to understand it and then and go through there. So yeah, that's how I got involved with it, and 18 years now, 2005 to now, right?
That's an absolutely
Yeah,
incredible story, and I mean, everything that you're saying just made absolute sense. And undeniably, I can't disagree with anything. And I just wanted to backtrack towards the obviously you
So
created a very
real quick,
sure,
Jack,
go
and
for it.
and this is like, so it looks like you have
Nice.
8 minutes and 50 seconds. Do we want to
Yeah.
stop this and then redo it again? You want to stop so we could get another 40 minutes?
No, 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 it's fine. No, it's all good to carry on.
So
That's
you're
absolutely
not going
fine.
to run out, right? You're not going to run
Well,
out.
yeah, we're going to run out in about 8 minutes or so. Yes.
All right, cool.
But so if I mean, yeah, so I just didn't want
I
to
could keep going. I got time. I keep going. I don't want to like restrict you.
Oh, oh, of course, nice. Yeah, I didn't want to use up all your time,
Yeah.
but yeah, if we run over, we can always hit a part two. That's no
Yeah.
problem at all.
Yeah.
Perfect. Yeah, one thing I want to ask is obviously you built such a high volume practice,
Right.
and for a lot of people that might seem almost unfathomable to imagine, and it's not something that we see over here in the UK. But for those of you, or for those of people who are interested in developing a high volume practice, how did you go about getting there, and what technique did you apply in order to be able to see that volume of people?
No, great question. So, everybody watching, um, the best way to learn something, and they don't talk about it anymore, is apprenticing.
Mhm.
You know, apprenticing sounds like such an old, it's the best thing in the world because so what I did is remember, I had an experience with a certain type of chiropractic practice. It was a high volume practice. I was on the table for a minute. I did some spinal rehab. I was out. It was like CBP, corrective care type of thing. Not necessarily CBP, but you know,
Around
that,
that.
right? So
Yeah.
that was my experience that I got well. So there was a high volume practice. So that's the type thing I was used to. And if I was to paint a canvas of what I wanted, my vision, I wanted to look like that. So whatever type practice you guys want in your heart and what you could see in your vision, you go visit or you find a practice that's doing something very similar to you that's in real life, not in school, like real life. So, and you either I dedicated my time, or I talked to them, or I observed them, or I would even offer money, but no one took the money. But I even offered it, saying, but I work for free. I would do something. So I would go to an office that's practicing very similar to mine and just be, guys, you need 1 or 2 weeks in the office and you will learn everything you need to know to run a successful practice the way you want it to. So for me, I liked high volume. It looked cool. I like the family vibe. I like the speed. And so I just apprenticed and observed those offices. And
Nice.
I took even though I didn't understand a lot of things, I did it because they knew something through trial, error, years, and a lot of money and a lot of mistakes. Like they figured stuff out. So learning from them, I had a straight line to where I needed to go versus doing what they did to get there. So you find an office that's practicing very similar to yours, the way your vision is, and you learn, and then you take it to that level, and then you put your personality, and then you could tweak it at that point. But yeah, you apprentice, and I've seen people in 1 or 2 weeks pick it right up.
Nice.
Yeah.
Wow. That's really cool. And with are you in an open, is your clinic, is it an open plan, or is it do you work in closed room? How do you work?
No, open. It's like it's
Cool.
got bays. It's got bays, so it's partially open, but more open than you think. Yeah. I mean,
Mhm.
yeah, it's pretty much open.
And how do you, obviously education is a huge part
Right.
in what we do.
Yeah.
How do you go about educating your patients?
Yeah, so education is throughout the whole thing. So the new patient day one, you're educating them. Okay. Day two, we bring them back for day two. And we used to do a group report of findings, right? When I had a lot of people, that's what, like when I had a lot of people, wow, why'd you do a group report? Because I didn't know where to stick people. We had so many new patients. So it's like,
I
I would
see.
do it. I knew instead of saying the same thing 20 times that day, let me just say it once
Yeah.
to 20 people, right? So then the day two or the report of findings, you're educating them. Maybe you're educating them on phases of degeneration or subluxation or whatever you want to educate them on. And then I would show their findings, and then from there go over the care plan. So the education is there. Then you have table talk. Then you have then what was effective was once a month workshops on other areas of health, nutrition, exercise, supplementation, detoxification, like other things. But I every talk I did had always had nervous system as the foundation. Like if I'm talking about nutrition, I'm like, well, we could talk about food and everything, but listen, if your stomach's not functioning correctly, you're not digesting food correctly, if you're nervous, so the number one key to nutrition is your nervous system, right? Like the number one key to exercise is, so I always had that nervous system was the foundation, then nutrition, then exercise, like so I just reframed talks and added stuff. So monthly talks were really good. Dinners were very effective back in the day. Where I just do, that's how I'd educate people, just telling my story. So having workshops and stuff like that, or if you find videos of other doctors or chiropractors that are beneficial, play the videos in your office when people are waiting. So when someone comes in your office, they're only there a very short time. I don't care if they're in your office for an hour, it's still a short time for the week.
Yeah.
So you got to understand, like when they enter in your office, everything they see and hear and touch needs to be focused on the principle of causation and chiropractic, right? So because when they leave your place, they're bombarded with everything else. So if you find something good on YouTube, play it. If you like, make a playlist. Like I would just inundate them with education at all times when they're waiting, when they're talking. Yeah.
It's great. Yeah, I love that. And in regards to the people listening, would you was there anywhere that you'd recommend that they go in terms of any specific seminars or anything to listen to or go to in particular?
I mean, whatever seminars you find,
Mm.
great. But I think YouTube's wonderful. Like YouTube's great because this is something where, like, you go to a seminar and you get excited, right?
Yeah,
And then you come back and you're excited, then what happens? This happens. So I
yeah,
realized like seminars would do that to me too. So I'm like, why don't I go to a seminar every day? So I collected a lot of audios, even BJ Palmer audios, scratchy old art. You go on YouTube, BJ Palmer audios, boom. Or some of the old guys, old chiropractic guys speaking. And so every day I would listen to an audio and it'd be like going to a seminar. So instead of going to a seminar and then going like this, every day I'm listening to audios and it's keeping me to true north. It's keeping me sharp and focused. So, YouTube,
Mhm.
just look at speakers, like chiropractors on YouTube, start building playlists and listen to every day. And I think so. It's like you're going to a seminar every day. And that's really beneficial. And you're going to find certain guys you like and gals you like and gravitate towards. So you just start watching their stuff. So I would just go to YouTube and seminars you go to, great. Like Cal Jam was cool here in the States and stuff. But
Yeah,
at the end of the day, what are you doing daily? So I was either reading chiropractic stuff or listening to chiropractic stuff daily. And YouTube had a ton of it, guys, a lot of it.
amazing. Cool. That's really good. Thank you.
Yeah.
I was going to say, if you're happy to end this one just before it kicks us out, and we can start part two, and I can send you for a link. Is that all right?
Yeah, that'll work. Let's do it.
Perfect. Cool. I will send that through in just a minute.
All right. So I'll see you in a couple minutes.